Good morning, welcome back. Well, we will all be busting out that old summer wardrobe soon, and you know what that means, more skin. So if you're in pain or maybe you're just embarrassed by varicose veins, there is a solution. Dr. Jeffrey Martinez is a board-certified vascular surgeon with Veintec, and he is beautifying legs all over the city every day. Good morning.
Thanks for having us.
It's good to see you again.
Thank you.
I would think this would probably be a busy time of year for you when people are starting to realize, uh-oh.
It's starting to warm up, so
Yeah.
people are beginning to call, and we thought it's a good time to talk about varicose veins.
Yeah. Now, what's the difference between varicose veins and spider veins? Because they are very different.
Sure, there's really a spectrum of veins, and so usually the small veins that look like spider legs, those are the spider veins, are usually a blue or purplish type looking vein.
Okay.
You have the deeper veins that are a little bit larger that we call reticular veins that sometimes you can see under those. And then you also have the big bulky varicose veins that most people associate with veins.
And now I know we have some pictures and we're going to pull those up here in just a sec so people can see. Okay, so this is a before and after, but would this be a varicose, right?
Right. The ones on the left are the varicose veins, and then the after shots are once we've treated those.
Now they look very painful, doctor.
You know, patients can have a lot of different symptoms, from pain, itching, heaviness, throbbing, and in real severe forms they can actually have skin breakdown and ulceration and skin discoloration.
So are they a health risk? I mean, being painful isn't enough reason to get it treated, but is it bad for your health too?
Well, really, there may be in some of the larger veins, if they become varicose that are deep in the skin, you can develop a blood clot. That's a small subset of patients, but the real problem is the skin integrity breakdown and ulceration over a period of time, and we just don't have a way to predict who's going to fall into that category.
So how are they treated? If someone is suffering, they've got the varicose, they're in pain, they're just miserable, they come to see you, and what are their options?
Well, it's really important to see somebody that can treat varicose veins. At Veintec, we have 5 board-certified vascular surgeons that are trained in treatment of veins and arteries. And so the spectrum of disease, it's not always what you see on the surface like these the pictures we have. They can be deeper. So you need to look at those and determine what the best treatment plan. For the spider veins and the small veins, generally an injection with a tiny needle and some chemical solution takes care of those veins fine.
A lot less invasive there to fix the spider veins. Now, what about recovery? Now, these are spider veins here we see.
These are the spider veins there, and those are generally what we can treat with some injections.
Okay. And then what is the recovery like for each of these?
All of these procedures are done in the office, so they're outpatient procedures. For the most part, patients can go about their regular activity during the day. Usually we may have them cut back on their strenuous activity for a few days.
Like, don't go jog a half marathon.
Right.
Take it easy.
That might hurt you.
That might hurt a little bit. Who do you find, or who do you see that comes to you mostly with these veins? Is it all women? Is it mostly women? Is it men too? Is it women who have just had a baby? Because I know pregnancy can cause some doozies too.
Pregnancy can really lead to increased varicose veins just with carrying the baby, carrying extra blood volume for the baby. All that puts pressure on those veins, and they just don't quite go back together the way they were before.
And men? Men
get them too, and we do see more women than men, but when we see the men, they're usually pretty bad off.
It's because we show more leg. It's probably a good thing a lot of the men aren't showing more leg, right?
That's right.
But if you want to, Dr. Martinez can make sure your legs look perfect. Okay, so you have a special offer right now for the first 10 callers to Veintec.
$50 off any of our cosmetic treatments at either one of our locations, both in Stone Oak and the Medical Center area.
2 of them.
And the phone number's on the screen there.
Got it. 210-614-7467. And if you would like to set up a consultation, see what they can do for you over at Veintec, this is the time to go and get that problem fixed, because I would imagine a lot of people are self-conscious too.
They are.
If they're dealing with the veins. So again, 2 locations in the Med Center, also in Stone Oak, and you can go to veintec.com for all of the info that you need. Thank you so much, Dr. Martinez.
Thanks,
It's good
Kimberly.
to see you.
Good to see you.